The next question. Which of these statements about the adductor canal is incorrect? Which of these statements about the adductor canal is incorrect? So as I read the options, you tick the correct ones and the incorrect ones. So which of these statements about the adductor canal is incorrect? A. It is the communication between the femoral triangle and popliteal fossa. B. It is bordered posteriorly by adductor longus and magnus. C. It contains the nerve to vastus medialis. D. The saphenous nerve exists the canal medial. And E. The femoral artery exists through a hiatus in the adductor longus. Which of these statements about the adductor canal is incorrect? I'm giving you a few seconds to think about this. The incorrect statement is E, which means that the femoral artery exists through a hiatus in adductor longus. This statement is incorrect. Explanation. The femoral artery exists the adductor canal through the adductor hiatus in the adductor magnus, which enables the femoral artery to enter the popliteal fossa. So the femoral artery exists the canal, which is the adductor canal, through the adductor hiatus. And the adductor hiatus is a gap between the hamstring and the adductor portions of the adductor magnus. So the hiatus is not through the adductor longus, but it's rather through the adductor magnus. So A is correct because the adductor canal, which is also known as the Hunter's canal or the subsatural canal, is a fascial tunnel beginning at the apex of the femoral triangle and continues distally with the popliteal fossa. B is also correct because the floor of the canal is formed by the adductor longus superiorly and the adductor magnus inferiorly, and anteriorly the canal is formed by sartorius medially and vastus medialis laterally, and the roof is formed by sartorius and subsartorial fascia. C is correct because the content of the canal at the femoral artery and being the saphenous nerve and proximally the nerve to vastus medialis, which is a branch of the femoral nerve. D is also correct because the saphenous nerve exists medially at the apex of the adductor canal, piercing through the fascia lata between sartorius and vice versa. Here, the saphenous nerve descends in close relation to the great saphenous vein. Next question. Which statement does not correctly describe the ligaments of the knee joint? Which statement does not correctly describe the ligaments of the knee joint. So, as I read the options, kindly indicate which ones correctly describe and which one that has not correctly described the ligaments of the knee joint. A. The medial meniscus is larger than the lateral meniscus. The lateral meniscus is attached to the lateral collateral ligament. B. The lateral meniscus is attached to the lateral collateral ligament. C. The transverse ligament of the knee attaches to both meniscus. The transverse ligament of the knee attaches to both menisci. D. The anterior cruciate ligament prevents hyperextension of the knee. And E. The posterior cruciate ligament inserts onto the medial femoral corner. So what's the answer? The correct answer is B. So B does not correctly describe the ligaments of the knee joints. That is, the lateral meniscus is attached to the lateral collateral ligament. Explanation. So the lateral collateral ligament, which is also called the fibular collateral ligament, is entirely extracapsular and separated from the lateral meniscus by the tendon of the popliteus muscle, whereas the medial meniscus is attached and in continuous with the medial or the tibial collateral ligament. A is correct because the medial meniscus is larger and less curved than the lateral meniscus. And also, both menisci are crescent-shaped fibrocartilaginous structures and are attached to a tibial intercondylar area and the capsule of the knee joint. C is correct because the transverse ligament of the knee attaches to both menisci and also to the anterior intercondylar area of the tibia. D is correct because the anterior and posterior cruciate ligament prevents anterior and posterior displacement of the tibia or the femur respectively, and the anterior cruciate ligament tightens on extension of the knee and prevents hyperextension, whereas the posterior cruciate ligament prevents hyperflexion. The cruciate ligament take their name from their origin on the tibial intercondylar areas, such that the anterior cruciate ligament originates from the anterior part and the posterior cruciate ligaments originate from the posterior parts, and they cross as they pass superiorly to insert onto the condyles of the femur, such that the anterior passes to the lateral femoral condyle and the posterior passes to the medial femoral condyle.